Hello and welcome to all. I think we can get started, even though some people might still be trickling in. My name is Jessica Huang. I'm a 2020 graduate of the DRPH program, the Doctor of Public Health program, and a current member of the Alumni Weekend Committee. I'm also excited to be joining the newly formed Alumni Association Special Committee on Climate Change and Advocacy. I currently work with the World Bank, conducting climate and health vulnerability assessments in the Asia Pacific region. But while I was still a student at the Harvard Chance School, I was fortunate to receive a scholarship to participate in an Advocacy Day on eating disorders in Washington, D.C., led by today's faculty speaker. What I learned from this advocacy experience made a lasting impression on me, so it's my pleasure to introduce our speaker to you now. Today's program, as part of this week's Volunteer Leadership Summit, is a faculty spotlight session with Dr. Bryn. Dr. Austin is an award-winning researcher, teacher, and mentor. She's a professor of social and behavioral sciences at the Harvard Chan School of Public Health, a professor of pediatrics at Harvard Medical School, and a research faculty member in the Division of Adolescent and Young Adult Medicine at Boston Children's Hospital. Dr. Austin is the founding director of the Strategic Training Initiative, for the Prevention of Eating Disorders, a public health incubator, known by the acronym STRIPED. She's founder and faculty member of the Sexual Orientation, Gender Identity, and Expression Health Equity Research Collaborative, and both of these are based at the Harvard Chan School of Public Health and Boston Children's Hospital. So I'll pass it over to Dr. Austin to give her presentation, and then we'll have some time for audience questions. You're welcome to use your chat feature to submit your questions at any time, and we'll do our best to get to as many as we can. Thanks again to everyone for joining us today for this really important conversation. And Dr. Austin, over to you.
Thank you so much for that introduction, Jessica. It's a pleasure to be here as an alum of the Harvard Chan School myself, and I'm so glad to learn that you are at the Eating Disorders Coalition Advocacy Day. I'm going to get to that in just a little bit in my talk. So for the next 30 minutes or so, I'm going to talk about what we know so far about social media and teen mental health, and particularly with a focus on eating disorders. The quote here, monetizing misery, at the title of my talk, I'm going to explain in just a few minutes. Before I begin, I want to say I have no disclosures. I receive no funding from, nor have I signed a non-disclosure agreement or NDA with social media companies or the tech industry generally. Now, we all remember back last fall in September when the Wall Street Journal dropped the Facebook files. That was their series of investigative articles based on the treasure trove of documents released by whistleblower from Facebook, Frances Haugen. And you'll also remember there was hearings in Washington in the Senate addressing these issues and all of the kinds of documents that she revealed. And this was covered nationwide and worldwide. The kinds of information she released out of Facebook really blew the lid off of this issue last fall. Covered by New York Times, where they wrote that Haugen was spending hours, as many of you may remember, being grilled by lawmakers and talking about what all was found in those papers, covered by Washington Post and pretty much every other paper. The key takeaways from the whistleblowers, the documents, that is Haugen's documents, the Washington Post said that, quote, the trove of internal Facebook documents reveals that the social media giant has privately and meticulously tracked the real world harms exacerbated by its platforms, ignored warnings from its employees about the risks of their design decisions, and exposed vulnerable communities around the world to a cocktail of dangerous content. This is from the Washington Post. I want to share with you one other document, a report that came out at the time, and this was an op-ed written by a parent, Ian Russell, who described his experience with his daughter. What he titled his op-ed was that his daughter was driven to suicide by social media, in his view. And what he wrote was that it's time for Facebook to stop monetizing misery. And I will explain that in a moment of how he came to that. As Russell wrote in his op-ed last fall in the Washington Post, quote, Haugen explained in her testimony before the US Senate how Facebook's algorithms use engagement-based rankings to tailor content to each user, often showing them more and more extreme content based on what they engage with. He goes on to write about his daughter, Molly. For Molly, this meant an Instagram feed full of suicidal ideation and self-harm. He goes on to write, And no one outside of Facebook knows how the algorithm is designed and what its effects are on its users. There are no means by which governments or independent regulators can review company policies and data to ensure its product isn't leading to harm or even death. So these are the powerful words of a father of a daughter who was lost to suicide. So we mentioned at the beginning that I'm going to talk about eating disorders also. So what I'd like to do for the next few minutes is give you some basic understanding about the latest research on eating disorders. Then I'll bring it back to the pandemic and to social media. Just recently, in 2020, my organization, Striped, Strategic Training Initiative for Prevention of Eating Disorders, public health incubator, research and training program based at the Harvard Chan School and Boston Children's Hospital. We teamed up with Deloitte Access Economics to produce the most comprehensive social and economic costing study of eating disorders in the US. You can see it at this bit.ly here or the QR code, and I'll put that up again in a minute, and you'll see it in the chat also if anyone's interested. Basic takeaways on eating disorders from our report. Eating disorders are common, they are deadly, and they are expensive. Nearly 30 million Americans alive today, or almost 9% of the population, will have an eating disorder at some point in their lives. Nearly 2 million children alive today will have an eating disorder before they are 20 years old. As we include in the report, eating disorders affect all ages, people starting as young as 5, over 80 years old, all race ethnicity groups. However, people of color with eating disorders are half as likely to be diagnosed or to be able to receive treatment. All genders are affected, with females being about 2 times more likely to experience an eating disorder than males, and there's emerging research of higher rates in transgender and gender non-binary communities also. All sexual orientation groups, all body sizes are affected. We estimate that over 10,000 deaths each year in the US are a direct result of an eating disorder, which equates to 1 death every 52 minutes in this country. Eating disorders have among the highest case fatality rate of any mental health condition. It's estimated that 20% of deaths for anorexia nervosa are due to suicide. One large study of US college students found that those with eating disorder symptoms were 11 times more likely to attempt suicide than those with no eating disorder symptoms. And few in public health realize this, but food insecurity, something is worsened by the pandemic, food insecurity is linked with vomiting and abuse of laxatives or diuretics, all for weight control, binge eating disorder, and bulimia nervosa. Main economic findings from our report, we estimated that eating disorders cost the US economy almost $65 billion every year, and an additional $326 billion in lost well-being. Now, how does this compare to other conditions? We know that it's comparable and in some cases exceeds. Another serious condition in the US, Parkinson's disease, is estimated at $53.8 billion per year, costing the economy, with eating disorders exceeding that at $65 billion. Also, schizophrenia, very serious condition. The estimates on schizophrenia's cost to the economy range from $27.6 billion to $111 billion, with eating disorders coming right in the middle of that range. Again, if you're interested in this report, it's in the chat, the bit.ly to find it, the link, or take a picture of the QR code. Now, all the data I just presented you was from before the pandemic. So how has the pandemic affected eating disorders? I'm sure you know some of how it's affected mental health. As you'll remember, within the first few months of the COVID-19 pandemic, we had widespread mental distress, including 3-fold increase in depressive symptoms. The pandemic brought a perfect storm of fear, social isolation, disruption of normal routines and care access, extreme stress and uncertainty, and financial precarity. And all of these are linked with depressive symptoms, anxiety, suicidality, and eating disorders. This same perfect storm was linked with worsening restriction, purging, binge eating, hyperexercise, all can be symptoms of an eating disorder. And it was exacerbated by news media and social media hyper-focus on weight gain due to the disruption of normal routines and on outcomes for COVID-19 for people with higher weight. All of this created an environment of intense fat shaming, pressure to restrict, reduce weight, skyrocketing rates of eating disorders among teens, and now the need for care for eating disorders in this country far outstrips our capacity in the health system. I'm going to show you the next 3 slides are data from during the pandemic on eating disorders rates. This first slide is from a study published from colleagues of mine at Boston Children's Hospital. During the pandemic, they found that the eating disorders caseload increased 2 to 3 times compared to pre-pandemic for inpatient at the hospital, Children's Hospital. You'll see the vertical line here with pandemic onset and the sharp increase. Another study published by colleagues at Michigan in Ann Arbor, at Children's Hospital there, same finding, 2 to 3 times higher rates, the eating disorder caseload after the pandemic started here. And now my colleagues have new data from children's hospitals across the country, where they're finding this basically everywhere at children's hospitals, doubling or tripling of the eating disorders caseload since the start of the pandemic. Now, these data were just released in February by the CDC in the MMWR. What they did was look at emergency department data nationwide, all across the country. And what they documented was a doubling of the eating disorders caseload to emergency departments, particularly among teen girls. So the dark line, blue line you're seeing here is the uptick in eating disorders caseloads there in girls ages 12 to 17. So now I want to take it back to link to social media during the pandemic and what we know so far about how social media can affect vulnerable teens, especially around eating disorders and mental health. So in an increasingly digital world where 1/4 of adolescents are on social media almost constantly, as the research has found, social media platforms continually bombard youth with highly visual content that is extremely engaging by design. And it's the visual platforms that we're especially concerned about. Now, the latest data from Rideout and colleagues just recently released during the pandemic, data collected during the pandemic, among 13 to 18-year-olds, nearly 2/3 use social media every day. And though there's a federally set minimum permissible age of 13 to use social media in the US, despite that, nearly 20% of children ages 8 to 12, so under the minimum, use social media daily. Now, we know from longitudinal research with social media engagement among young people that there's a reciprocal relationship between depressed mood and engagement in adolescence, such that vulnerable youth are drawn in by algorithm engagement practices, which I talked about at the beginning here. And then these then are associated with a worsening of mental health indicators. A large longitudinal study, this was just in the news recently, released data over many years with youth ages 10 to 21 years old and found distinct developmental periods for heightened sensitivity to the negative effects of social media. What they found is among girls ages 11 to 13 and among boys ages 14 to 15. Now remember, boys are shifted a few years from girls on when the stages of maturation for puberty. So these are fairly aligned with puberty onset. Higher social media use predicted reduced life satisfaction 1 year later. So again, longitudinal data from a very large cohort in the UK. Now, I want to say a little bit more specific to eating disorders. The research has been a number of studies related to eating disorders and body image. High frequency and prolonged use of social media is linked with negative appearance comparison. And negative appearance comparison, we know, is linked with increased risk of developing an eating disorder. So this effect with social media on negative appearance comparison then is in turn associated with the increased risk of more eating disorder symptoms going forward. Now, these engagement-tailored algorithms, they're designed to feed extreme eating disorder user-generated content. They're designed to feed content that will keep a user engaged longer, and it is known that extreme content does that. So when a young person shows some interest in dieting or comparison of their appearance or weight, that's when the algorithms got them. They're hooked, and the algorithm will continue to feed them extreme content. But we know from a recent report from investigative journalists that once this content is identified, then ad placement for mainstream youth brands, it could be Nike, could be Forever 21, are deliberately placed by the algorithm between extreme eating disorder content and videos. You can see there's a very problematic practice that the algorithms achieve and it's putting kids at risk and normalizing the extreme content by having these mainstream brands adjacent to that content. I'm going to come back to this point in a little bit. Several investigative reports, and they're just piling up, from investigative watchdog groups. Tech Transparency Project released 2 reports in December, just a few months ago. One, Instagram's algorithm is fueling eating disorders, is what they concluded from their report. You can get it at this bit.ly or at the QR code. It's also in the chat for you. And another report, the Tech Transparency Project released also in December, about illicit drugs. Xanax, ecstasy, and opioids. Instagram is offering a drug pipeline to kids, is what they concluded from this investigative report. And another from the Wall Street Journal, also in December. It's just one right after the other. The Wall Street Journal investigative report, they titled "The Corpse Bride Diet, Taking from an Actual Diet Put on TikTok." In this case, it's not Instagram, they're looking at TikTok, which has gotten far less research, inundating teens with eating disorder videos. So what the Wall Street Journal did was they created a dozen automated TikTok accounts, registered them as 13-year-olds. And then what they found was, with these automated accounts, within a few weeks, the algorithm served them tens of thousands of weight loss videos, including so-called tips on how to eat less than 300 calories in a day, consume only water in a day, or to take laxatives. These tips also depicted emaciated teen girls with protruding bones and this diet, the so-called corpse bride diet. This is what teen girls, and especially because of the algorithms being personalized, teen girls that show any vulnerability to weight concerns or eating disorder symptoms are getting funneled this kind of dangerous content. These are a few screen grabs from what was showing up in the feeds for these automated accounts. I'll just read the center one there, where the message going to these vulnerable teen girls out there through the personalized algorithm, it reads, "Look at your pathetic self. How much calories have you eaten today? 1,500, 2,000, 2,500? I'm not even surprised. Fat pig, go work out instead of complaining about how you can't lose weight." These are the messages that are getting out on TikTok, and the algorithm is driving to users who are identified as being so-called interested in weight loss, dieting, body image, having these vulnerabilities. So I want to mention one other issue through what's happening through social media before I get to solutions, which I will offer some. So social media, we know, is promoting deceptive and dangerous diet pills and is preying on the psychologically vulnerable. We have pretty strong research around even this particular area of dangerous diet pills. So dangerous and poorly regulated diet products, such as weight loss supplements, are widely promoted via ads, affiliated marketers, influencers on platforms that we know also have enormous youth following. So platforms where there's millions of youth. These products are marketed with deceptive messaging as so-called self-care or as health protection, despite the acute risks of these products, and there being no health benefit to over-the-counter diet pills, weight loss supplements. So we also know from other research that during the pandemic, use of weight loss supplements is linked with depressive symptoms, anxiety, high perceived stress, experiences of discrimination, and living in an area with weak pandemic protection policies. So you can see how there's a vulnerable set of users here who then these kinds of ads will be shuttled to through the algorithms and ad placement. So that's a lot to cover in terms of the latest research and why we're especially concerned around eating disorders and the ways the algorithms work. I want to take a step back and look backwards to history, more than 120 years ago. Is there anything we can learn? I'm going back to 1905. Many of you are probably familiar with The Jungle by Upton Sinclair, came out in 1905. This book, as you may remember, was a horrifying expose on derelict practices of the US meat industry and its repugnant and deadly products that Americans were consuming every single day. After a quarter century of advocacy, and bear in mind, The Jungle, this release of this book was not the beginning of the advocacy, it was after a quarter of a century of advocacy around the meatpacking industry. After a quarter of a century of advocacy and piecemeal lawmaking that didn't quite solve the problem, when The Jungle came out and gripped the nation, that catapulted the Pure Food and Drug Act to be signed into US federal law, 1906, so more than 120 years ago. This established the US FDA and more rigorous regulation to ban toxic ingredients, prohibit deception, and require transparency of foods and drugs. So this is where the FDA began, almost 120 years ago, is when this began, after the jungle came out. So with that, raises a question, could now, with the release of the Facebook files, with the hearings, with the Hogan as a whistleblower, and so many other whistleblowers and investigative reporting and research, could this be a watershed moment now for big tech? We have some similarities when we look back almost 120 years. Is big tech could be the modern day version of the meatpacking industry of Upton Sinclair's day, perhaps. What's parallel with that example I just gave from history is there's currently no transparency or accountability for algorithms. If we want to take that analogy of the meat that the meatpacking industry put out on the market for Americans to consume, and algorithms which Americans are consuming through social media. There's no public documentation now of the impact on health, mental health, or other adverse effects. And there is no government oversight, inspection, or auditing of algorithms, tools, or practices by industry. Very similar. So where do we go from here? I want to turn now to a few policy options. We do have options. We do have options for how we can address the situation if we seize the momentum of this watershed moment. I'm going to give you a set of recommendations and say a little bit about each of them. First recommendation, we need to establish government authority to audit algorithms, tools, and processes. We can set up a robust oversight on social media platforms, search engines, and tech industry more broadly. We can apply U.S. Federal Trade Commission, the FTC, fairness standards. Now, they already have the authority to do this. It just needs to act and have a clear sense of how they're going to act. So we can apply the existing FTC fairness standards to compel accountability, transparency, and penalties for unfair practices by platforms. And breaking news on this front, in 2023, New York City's already passed a law, takes effect in 2023, to mandate external auditing of automated employment decision tools. So these are algorithms that are used for hiring, firing, promotions. And the auditing is designed to ensure that these algorithms are not replicating racist or sexist or other biased employment practices. So New York City has this coming online in 2023, and other jurisdictions are looking, no doubt, looking to do something similar. Second recommendation, we need to ensure government auditing bodies have appropriate expertise and independence. We cannot task shift this auditing to industry. We must prevent industry from requiring NDAs to be used to silence advisors. And the industry does use these, whether someone gets money or doesn't get money, they sign an NDA because they have some relationship with industry, they are prevented from speaking about what's happening. Auditing bodies must include mental health, child development experts, in addition to data science technical experts of diverse backgrounds. We've heard again and again just how not diverse data science and technical experts at these platforms are, and they're making mistakes and they're replicating the racist and other kinds of bias thinking in their algorithms. Diverse backgrounds will be critical, and bias training. I'll get back to that in a moment. Auditing bodies must have institutionalized protections from political interference. Right now, this is a bipartisan issue, but it's seen differently across parties. A third recommendation, require disclosure of algorithms, tools, and processes along with internal research on their effects on health, mental health, and social behavior of users. Hogan revealed to us, we know that they know. They've known for years what it's doing to teen girls' body image and other users, vulnerable users. That needs to be public. We need to apply similar standard of disclosure, public data access, as we do with pharmaceuticals, as the FDA has allowed us to do for almost 120 years, which would be to disclose, for pharmaceuticals, is disclose the chemical composition of drugs. The chemical composition of drugs is not a secret. It's public information. The same should be true for algorithms. Register clinical trials and report results of trials on drugs effects. The same for all the trials that these industry platforms are running. They're running trials on us every day. That needs to be public. Data must be made accessible in a timely way to researchers, journalists, NGOs, the watchdogs. A fourth recommendation, institute age-appropriate requirements following the new UK child safety law. Back in September of last year, UK had sweeping rules to protect children with age-appropriate design instructions for platforms. And all platforms operating in the UK have to follow these unless they can prove they don't have any children on their platforms. A few examples of what this does. Eliminate nudge techniques to get users to give up privacy, minimize data collection on children, and give children privacy defaulted to maximum security for the child. Now, breaking news on this one, currently California is considering legislation modeled on the UK law. And it's being considered in the state legislature. If it's successful this year or soon, this likely will be a model for other states across the country. They're all looking to California to see what happens there. A fifth recommendation, create social media child protection advisory council via our federal agencies like SAMHSA, HHS to identify and target practices harmful to mental health. We need the mental health agencies to be advising the FTC. So FTC has the authority, but they don't have the mental health expertise. We also need coordinating with the CDC. The FTC is tasked with enforcement action on unfair and deceptive, misleading practices. However, the FTC lacks mental health expertise. We want to ensure the FTC is seeking guidance from HHS, CDC, our offices with the mental health and social media expertise. The sixth recommendation, create a permanent office at CDC dedicated to social media, mental health, and eating disorders. Currently, the CDC does not have a dedicated office for mental health in general, and not for eating disorders or social media. A CDC dedicated office could issue evidence-based recommendations for policy protections, advise the FTC and algorithm auditing body. They can increase public awareness and tools for families, parents, children to protect themselves through safer practices. They can also develop and evaluate prevention strategies for internet addictions and eating disorders in youth. A seventh recommendation, let's require improved AI tools to identify and remove eating disorders promoting and weight stigmatizing content. We can require evaluation and transparency on performance of AI tools, like New York is going to be requiring around employment tools. And these need to show effectiveness without unfairly removing content by users with stigmatized identities, such as BIPOC or Black, Indigenous, and other people of color, sexual and gender minorities, people living in larger bodies. And this content moderation teams need to have anti-bias training and reflect the diversity of the community. And on this point, I urge you to check out this new commentary article by Harvard Chan faculty, Dr. Josemir Matai and team, really thoughtful piece in Frontiers in Nutrition, just last November, weight stigma and social media evidence and public health solutions. This is in the chat. Also, you'll see the bit.ly there, the link, or take a picture of the QR code to read this excellent piece by Dr. Matai and her team. Now, eighth recommendation, prohibit ads, affiliated marketing, and influencer content promoting deceptive over-the-counter diet pills. In addition, we need to prohibit the placement of ads for youth brands, so these mainstream youth brands, next to content that's promoting dangerous weight loss products or eating disorders or body shaming, suicide, self-harm, or other extreme content. And here's a pro tip for those in the audience who are either in the business community or work with the business community. Here's a pro tip. Brands are tarnished when social media algorithms are allowed to place their brand ads next to extreme content. Brands could require external auditing through the contracting process. When they place ads with a social media platform, they could require external auditing of ad placement algorithms to ensure they're not placed next to reputation damaging extreme content. Anyone who might be attending the Better Business Bureau's Children's Advertising Review Unit annual conference, it's a massive conference. Highly recommend anyone who's going to be going to this conference in May to bring this up. Every brand, big brand, is going to be there. You all, or the brands, could be teaming up with each other to start requiring accountability so that they know their ads are not being placed next to extreme content and tarnishing their reputations. Now, the final recommendation before I get to the last part of my talk today. Ninth recommendation, prohibit social media platforms and search engines and other tech platforms from gathering or monetizing behavioral data from users under 18. Even when platforms say they don't allow weight loss ads to minors, they still gather behavioral data on children. Likely they're going to use that same information as soon as they turn 18. And they allow affiliated marketers, influencers, and other user-generated content, like what I presented earlier, promoting these dangerous products to still reach youth on their platforms. So that's a lot to take in. What I want to spend the last few minutes on is a few things you could do if you're interested in thinking about actions you can take. We're all in public health. We're often always thinking about action we can take. First thing, join us for the Eating Disorders Coalition virtual Capitol Hill Advocacy Day in May. Now it's virtual, it's via Zoom. It'll be Tuesday, May 17th this year, 9 to 5:30 Eastern time. With this, you can go to the Eating Disorders Coalition website to register at this bit.ly or take a picture of the QR code. It'll also be in the chat if you're interested in and available on Tuesday, May 17th. The Eating Disorders Coalition, one of the pieces of legislation in Congress we're working on is the Kids Online Safety Act. It was sponsored by Senator Blumenthal and Senator Blackburn. Part of this is motivated by all the information I already presented to you about eating disorders, body image, and those issues, and that's reflected in this legislation. This legislation is focused on what can be done through existing FTC authority to increase youth and parental controls, to have safer practices, having independent scientists have access to platform data in the public interest to be able to research the impacts on youth. It's working with the concept of duty of care, which is already very deeply embedded in FTC practice, would set up independent external audits to assess compliance and safety. There'll be a council to guide the work, and also enforcement via the FTC's existing authority in the Unfair and Deceptive Practices Act. So check us out, May 17th. You can sign up to participate in the virtual Capitol Hill Advocacy Day and let lawmakers in Washington know how you feel about these issues. One other thing I want to share with you, something else you can do. With my program Striped, based here at the school and at Boston Children's Hospital, we are working with colleagues and coalition with community organizations around the country on a multi-state campaign to ban the sale of OTC diet pills to kids online and in stores. And the bills are advancing in multiple US states this year, right now. In New York, this bill has passed both chambers in the state legislature. It's on its way to Governor Hochul's desk. In California, passed the assembly this year, is next going to the Senate soon this spring. Massachusetts, the bill is making its way through the legislature and committee hearings, and Missouri and New Jersey have now taken up this issue, have similar bills this year. Check us out at this link here or the QR code. This is our campaign, Out of Kids' Hands campaign. And one other thing you can do is actually this week, this Thursday, April 7th, 2:30 p.m. Eastern time, youth-led virtual event to urge Governor Kathy Hochul to sign the bill. This is a youth-led virtual event. Again, you don't need to travel. We've got a whole lineup of incredible speakers organized by the youth, and the youth will be speaking. The bit.ly is here, also in the chat, and the QR code. So with that, I want to leave you with one final quote from the father I mentioned, Ian Russell, father of Molly, and what he wrote in his Washington Post op-ed last October, quote, "Time is of the essence. Every week that companies such as Facebook are allowed to obstruct and obfuscate is another week that children like Molly will needlessly lose their lives." With that, thank you, and I am happy to answer any questions.
Thank you so much, Dr. Austin, for inspiring presentation. I hope to join your upcoming virtual event led by youth. Amelia is also putting out some information and links in the chat. And just as a reminder, we welcome you to submit questions through the chat feature, and we'll get to as many as we can. As you put so well, this topic is so important and urgent because of this perfect storm that you mentioned, exacerbated by the stresses, anxieties, isolation, financial instability, and other types of instability due to the COVID-19 pandemic. I know many of us in the audience probably personally know young people who are using social media starting from younger ages and with higher frequency or longer periods of time. You've presented really compelling data on how the current levels of regulation on social media platforms are failing our youth. This lack of regulation on social media and the corresponding negative health impacts also reminds me of some of our struggles with the viral spread of health misinformation, not to mention misinformation more broadly with consequences for our democracy. And I just really appreciate how you raised this interaction between eating disorders and people experiencing bias and discrimination, as we unfortunately still live in a time of injustice. This is all just to say that your work on mental health and well-being is so timely and deeply interconnected with some of the biggest health challenges before us. And rather than ending with despair, you've also shown us some clear pathways for solutions and how we can act. So we really, really appreciate you presenting to us today. I'm still waiting for some audience questions. So in the meantime, I hope it's okay if I pose a couple. So I'd love to hear more about, has there been progress in Congress to implement these health policy recommendations that you've shared with us? And what are some of the largest barriers that you see to implementing these policy changes?
Yeah, great question. And thank you for your remarks. I always want to make sure we're thinking about what can we do, because otherwise, too much of the news, the research, it can hold us back. It may make us lose our verve. But as public health professionals, we always are looking for what we can do better. Now, your questions about Congress, there have been hearings. There have been a number of pieces of legislation introduced. The one I mentioned, COSA, the Kids Online Safety Act, is a very promising one because it started from the get-go with bipartisan support. And we know Congress in the US is very evenly divided between parties. So anything that has a chance of getting through needs to be bipartisan. And this one is. Senator Blackburn and Senator Blumenthal represent two parties. There is movement on this, but it's probably everybody who watches US news knows that it is hard to get things through Congress. So that's why, as public health advocates, we never wait to just sit back and say, okay, well, let the feds take care of this and we'll just sit it out till that happens. Because actually what public health, they're masters in all different kinds of areas in getting movement on the municipal and on the state level. And that's actually a hallmark of American politics and American progressive public health action, is to work on local and state levels to get good policy done. We want evidence-based policy as public health professionals to get it done those levels, to be able to evaluate it and use that to inform what's done at the federal level. So actually states all across the country for a number of years now have been putting forward different kinds of legislation to address the safety issues, the privacy issues, the income issues, all kinds of things around how this works. Not all of that legislation was evidence-based. As we know, we really need scientists to be more involved in the process of crafting evidence-based legislation, informing it. But some of it is really good, really strong legislation at the state level. And probably the best piece right now is the one I mentioned in California. So anybody who's based in California or votes in California, I urge you to reach out to your lawmakers there. If you're supportive of stronger protections for children around social media, let your lawmaker in California know. That's important work, and all eyes are on California because they are a leader in this way. New York already has passed, the city level already passed a requirement for audits to address the problem that's been very well documented of racist practices being replicated through algorithms in hiring, access to loans, all kinds of ways. So New York, all eyes are going to be on New York and implementation there. If someone's in New York, I encourage you to get involved with that along those lines too.
Thank you. And I am a California citizen, so I'll need to reach out to my representatives. Again, anyone and everyone is welcome to submit questions in the chat. In the meantime, I'll continue with this wonderful list of questions that the Alumni Affairs Office helped us to craft. So continuing on with being evidence-based, what has been some of the reaction from social media companies to this research? Are any making positive changes?
Well, yes, there has been some positive reaction. A few months ago, in fact, TikTok established a new position for someone with these research expertise and clinical expertise in eating disorders. So it's good that they did that. They've also put together panels of experts, of researchers who know what's happening with young people to advise them. But I want to caution here. These panels, like for instance, Instagram has a youth panel, they require that researchers sign an NDA. That's what I mentioned earlier. They require, even if you don't get a dime from the platforms, if you have any kind of engagement like that, we're seeing more and more that they're requiring NDAs that basically are muzzling researchers about what they can say about the platforms. So that's like one step forward, 5 steps back. with some of these kinds of measures. But I think what it's going to come down to is not, do they have likes or do they not have likes, which is something that's been discussed. Do the likes harmful, or the likes not having an effect? If they get rid of likes, should we praise them for that? The fact is, it is still absolutely secret what they're doing in their algorithms. And I think it's, if anything, it's like, if we use the meatpacking analogy, as like if they dust off the bacteria from the meat, but still serve it to, or use a clean package and still serve it to Americans, the core problem of the secrecy, the lack of accountability there, is what it has to be changed. We have to see change there, and we are not seeing change from the platforms there. We need these algorithms to be audited, and it's in their own interest, and it's certainly in the interest of the business community. And I just want to highlight that point again, that the business community also has a voice here. It's not all up to government, or it's not all up to consumers, who have the least power in this scenario. The business community has a lot of power. The business community's ads are being placed, and I hear from the business community, they don't even know if what they're paying for is happening, where the ads are being placed. They don't know if they're being placed next to extreme content, but they should know. That can be in their contracts. These are the kind of levers that are going to really make substantial change. We need the algorithms to be transparent.
Sorry, I forgot to mute. A question just came in. Is it possible to pressure platforms such as TikTok and Instagram to create the equivalent of labels for consumers, certifying their algorithms certifying that their algorithms are not exploitative? Sorry. And also, can researchers get access to the troves of data that these platforms have? You talked about this lack of transparency. Can they be pressured to allow researchers access without NDAs?
Yeah, great. The terrific questions. Yes, government could compel the platforms to release. That's what the COSA Act, that's what has been proposed through FTC, existing authority. They can compel that these be transparent, so that researchers and tech watchdog groups and other nonprofits can all be looking at the ways that these algorithms are working. It could happen, it would take government action, or it would take the companies being willing to do this. It took the FDA had to be put in place to compel it back in 1906. We probably need more government compelling this. But an interesting point about that New York City bill or law now, which I didn't mention, in addition to requiring annual audits of their employment decision tools, they also require the platforms to report the results to the public every year. So that gets at the question about, could there be a label, this algorithm does not cause harm? What would be comparable and has actually been executed in law in New York City is that the algorithms have to do an external audit and they have to reveal the results. So that would be a way to get at this suggestion from the audience member.
Great, thank you. And thank you to the audience member who submitted that question. Again, everyone is welcome to submit a question. Even though we have a limited time, we'll do our best to get to what we can. In the meantime, I can ask one more. For people in our audience and community with young dependents, are there strategies we can use to help youth understand what they're seeing online, particularly when an adult can't be there with them all the time to navigate content?
Yeah, there are. There's the American Academy of Pediatrics has come out with some guidance for parents, because social media is not going away. There's a lot of good that happens on social media. I was just in a meeting with one of the high school students that Striped works with, and she was saying when the pandemic happened, her school, everything switched over to social media. That's how the school community communicates. Really important. So kids are online for that. So something to remember is, specifically around social media, the federal law is someone has to be 13. So it is not permissible for people younger than 13, although we know around 20%, close to 20% of younger kids are using social media. That's something that parents probably need a lot more awareness about, not letting kids get on when they're that young. AAP and some other Common Sense Media, some other groups out there are putting out some tools that parents can use and that young people can use. Like one of them that has been shown to be helpful, in research has shown to be helpful, is when young people have planned timeouts where they're going to step away from social media. They know they won't stay on for more than X amount of time. They'll put it down, do other activities in the analog world, in the offline. This is something, when kids are able to do that, we know that that's beneficial. Another thing that we know is beneficial is when kids have some agency over what they're producing. Now, this would be older kids. I'm not talking about younger than 13, but older kids have some agency where they're using the platforms to do advocacy. So for instance, our organization Striped works with high school students who produce videos on TikTok, but they're not about how much weight you could lose or what I eat in a day, which is one of the really noxious kinds of content on TikTok. Instead, what these youth are doing are posting videos about their advocacy around policy that affects eating disorders, young people, body image, and they're really seizing the control. That kind of production is beneficial to kids. We know that it's helpful when kids can do that. However, that's a drop in the bucket compared to the much bigger problem of the secrecy around algorithms. And it's something we just have to keep coming back to until we can crack that nut.
Great, thank you for the wonderful tips. Seeing as we're coming up on 10 till the hour, and we want to make sure we leave everybody enough time to transition to their next programs, let's end with one last question from an audience member, and who's also happens to be the president of the Alumni Association. The volume of drugs or devices are collectively many orders of magnitude less than algorithms used for the platforms stated. Practically speaking, given this volume, how is the oversight you propose implementable or practicable?
Great, excellent question. You're right. Algorithms out there are, countless, and compared to drugs, if the FDA oversees. This is why we need the decision scientists. This is why we need the data analysts and the auditing community to be part of coming up with solutions. Striped works with some professionals in this arena. There's actually a really well-known writer, a Harvard graduate, Kathy O'Neill, published Weapons of Math Destruction. Highly recommend it. That's MATH. And then her newest book, The Shame Machine, just came out. Highly recommend it. So people like Kathy and many others who have those skills around auditing have to be at the table, because this is a 101 in terms of evidence-based policy or policy generation. You have to be thinking about the end user and the practical application. You can have a wonderful, virtuous policy or law put into effect because people who care put it forward, but it was never vetted by the end users, and then it'll never be implemented. And I appreciate this question from the president of the association, because we absolutely have to be connecting all of those dots. That's not always happening with lawmakers who are passionate about this issue. It is happening around COSA, and it is happening in California and some of this other legislation that's really well crafted. And so we need to keep those voices at the table to help come up with solutions.
Thank you. Thank you again to you, Dr. Austin, for speaking, and to everyone who's joined us today. This has been an incredibly informative session, and it gave us a lot to think about. And there's several more Volunteer Leadership Summit programs coming up this week. So we'll be dropping a link in the chat for anybody who's interested in registering for more, in case you haven't already. And just want to wish everybody a good rest of your day.
Thank you.
Thank you.